Hello and welcome. Today we're going to discuss medication education and mental illness. What is mental illness? According to the National Alliance for Mental Illness, also known as NAMI, a mental illness is a medical condition that disrupts a person's thinking, feeling, mood, ability to relate to others, and daily functioning. Currently, there are approximately 61.5 million Americans that have a mental illness. That means there are 1 in 4 people who need help, so you're not alone. There are many serious mental illnesses. Some of these include major depression, schizophrenia, bipolar disorder, post-traumatic stress disorder, also known as PTSD. We are currently seeing more PTSD in our veterans who are returning home from war in the Middle East. Mental illness can affect any person, regardless of age, race, religion, or socioeconomic status. There's no cure for mental illness, but there is hope for individuals to live a fulfilling life through individual treatment. When I like to explain mental illness to people, I like to correlate mental illness between that and brain cancer. There is no cure for mental illness. However, you can put it in remission like cancer. And in order to put mental illness in remission, an individual may have to take medication. These medications may have some serious side effects, just like some of the medications that cancer patients take. Chemotherapy and radiation have major side effects, but however, in the end, these side effects are not as bad as putting the cancer in remission. This is the same with mental illness. Each one of these mental disorders has specific medications that can be used by an individual. Alright, so let's talk about a few of the mental illnesses and the different medications available for treatment. Also, what may be some of the side effects of these medications. The first 2 medications are used to treat schizophrenia. They're also known as typical antipsychotics. One of the very old antipsychotics used is Haldol. Haldol comes in many forms. It comes in a pill form, liquid form, immediate acting shot, which is used in emergency situations, and long acting shot form, which is also known as Haldol decanoate. It is given about every 2 weeks. Some of the side effects common with Haldol include feeling sleepy, dizziness, headache, constipation, dry mouth. Thorazine is another one of the typical antipsychotics. It pretty much has the same side effects as Haldol, such as feeling sleepy, dryness, headache, constipation. However, these 2 antipsychotics may also cause some major side effects, like extrapyramidal symptoms, also known as EPS, which include an acute dystonic reaction. Some of these dystonic reactions are torticollis, which is a neck spasm where the neck twists and turns up. Oculogyric crisis, where the eyes kind of roll back into your head. Swelling of the tongue or jaw. Another one of the EPS side effects is known as akathisia, which is a feeling of restlessness, unable for a person to sit still for any length of time. Pseudoparkinsonism is another EPS symptom, which includes muscle rigidity, also known as cogwheeling, and slight tremors. If these medications are used by individuals for a long time, tardive dyskinesia can also occur. This is an abnormal movements in the tongue, excessive eye blinking, lip smacking, and grimacing. With tardive dyskinesia, it may never go away. Along with these side effects, these antipsychotic medications can cause some very bad, sometimes fatal side effects known as neuroleptic malignant syndrome, aka NMS. These symptoms include fever, muscle cramps or stiffness, dizziness, very bad headache, confusion, change in thinking, unusually fast heartbeat, and excessive sweating. If you have any of these severe symptoms, call your doctor, go to the nearest emergency room, or call 911. There's some newer antipsychotics out there. They're also known as the atypical antipsychotics. I'd like to talk about a few of them today. First one we'll talk about is Abilify. It too has the same common side effects as the typical antipsychotics, but they are much less. But they are the headache, the dry mouth, constipation. Also with these atypical antipsychotics, the long-term side effects, those are the major ones like the tardive dyskinesia and things like that. Those are definitely less with the atypical antipsychotics. Another one of these atypical antipsychotic medications is Zyprexa. It too has the same common side effects, the dry mouth, the constipation, the dizziness. One of the interesting facts about these two medications, these two new atypical antipsychotics, Abilify and Zyprexa, is that they come in a disintegrating tablet form. It's used for people who have a tough time swallowing pills, and for the elderly who also have a tough time swallowing the pills. So that's enough about atypical and typical antipsychotics. The next two medications we're going to talk about are used to treat depression. The ones I'm going to talk about are Zoloft and Prozac. They basically have the same common side effects, which includes dizziness, weight gain, problems with sex, upset stomach, and headache. One of the major side effects of antidepressants is that they may treat the depression, but they also may increase suicidality in people. If this does happen, please call 911. The last two medications that we're going to discuss today are used to treat bipolar disorder. These medications are also known as mood stabilizers. One medication is lithium. Some of the common side effects of lithium include upset stomach, feeling tired or weak, increased thirst. Lithium is a medication that must be taken with caution. It has a certain level that it needs to be in the blood, and that level is 0.6 to 1.2. Your doctor will inform you how often you have to have lab work done. Could be every other week, once a month, it all depends. If your levels do get too high though, it's known as lithium toxicity. Lithium toxicity can be pretty serious. The side effects to be aware of and to look out for with lithium toxicity are persistent diarrhea, vomiting, hand or leg tremors, blurred vision, marked dizziness, slurred speech, irregular heartbeat, and swelling of the feet or legs. Lithium toxicity can lead to coma, brain damage, or death. So if you're experiencing any of these symptoms, stop taking the medication immediately, call your doctor, or go to the nearest emergency room, or call 911. The last mood stabilizer we're going to talk about today is Depakote. It too is used to treat bipolar. Some of the common side effects of Depakote are headache, weight gain, dry mouth, restlessness, and swollen joints. Depakote, like lithium, also needs to have lab strong. Normal levels for Depakote are between 100 and 125. This too will be determined by your doctor how often you need to have your blood work done. In the end, these medications, just like any other medication, can cause an allergic reaction like rash, hives, itching, red swollen blistered skin, fever, wheezing, tightness in the throat or chest, and swelling of the mouth, face, lips, tongue, and throat. If any of these symptoms occur, go to your nearest emergency room or call 911 immediately. So let's remember, it's up to you to do your part to put your mental illness in remission so that you can live a fulfilling life. Thank you.